Hello, I'm Jim Blumenstock, Chief Program Officer for Health Security at the Association of State and Territorial Health Officials. State and local health officials have been working tirelessly to stop the spread of COVID-19 in communities across the United States. While there's still a long path ahead for all of us, we are beginning to see appreciable positive behavior change, in part due to new policies to reduce exposure to the virus and help flatten the epidemiologic curve. On April 17th, the CDC published an article in its Morbidity, Mortality Weekly Report, commonly referred to as the MMWR, describing the relationship between the timing of certain community mitigation public policy measures, community mobility, which served as a proxy measure for social distancing, and trends of reported COVID-19 cases in 4 metropolitan areas. I want to highlight some of the findings and discuss what this means moving forward. An important component of community mitigation is social distancing, which is when we maintain a safe physical distance from others in a community setting, including staying at home. When medical countermeasures like vaccines and proven therapeutics are not available, social distancing becomes a critical factor to prevent the spread of disease. Public policy measures, along with heightened public awareness and an understanding of the seriousness of the issue, play a significant role in promoting social distancing, ideally leading to individuals staying at home with the goal of decreasing disease transmission within a community. Over the course of 5 weeks in March, New Orleans, New York City, San Francisco, and Seattle all instituted several public policy measures to try to slow the spread of COVID-19 infections. The first policy that affected each city was a statewide emergency declaration. When a governor declares an emergency, it not only sends a clear message regarding the gravity of a situation, but also triggers additional legal authorities and operational resources available to respond to an emergency, and has implications for government agencies, the private sector, and the public as well. The data show that emergency declarations alone did not have a substantial change in individual mobility. In this study, increased mobility was defined as someone leaving their home, as determined by available anonymous personal mobile device data. However, as additional policies such as limits on gatherings and school closures were introduced, the percentage of residents who left their homes decreased. Overall awareness and concern over COVID-19 among the general public, coupled with the White House 15 days to slow the spread guidelines, also likely led to reduced mobility. And when stay-at-home orders were implemented in these jurisdictions, an additional decline was noted in individuals leaving their home. Finally, the report discusses the appearance of very early indications of the potential impact of policies and social distancing on later changes in cases, recognizing that clearly more study is needed in this area. So what does this mean for public health practice? Well, as the report concludes, this analysis suggests that policies to increase social distancing when case counts are increasing can be an important tool for communities as changes in our behavior result in decreased spread of COVID-19. ASTHO certainly wants to thank the CDC for producing this report, and for the public health agencies of the 4 metropolitan areas covered in the study for their contributions in expanding our body of understanding and knowledge of COVID-19. The link to the MMWR report can be found in the show notes. Again, I am Jim Blumenstock, and thank you for watching.